Nuclear transcription factor PIT1 is now called as. Now, what is this nuclear transcription factor? Let us see what it is. Nuclear transcription factor. What exactly it is? Nuclear transcription factor PIT1. Are we able to hear me clearly? Now let us see what is POU1F. POU1F, POW-F stands for POW domain. Class 1 home box 1. PIT1 is a pituitary lineage determining factor. Pituitary lineage determining factor. Now coming to PIT1 is also known as POW1F1. It is a nuclear transcription factor that plays a crucial role in the development and functioning of the pituitary gland. Now, PIT1 is POU1F1, POW1F1. So the correct answer here is POW1F1. Peak ACTH secretion. Peak ACTH secretion occurs at. Now let us see what this ACTH is. We all know it is adrenocorticotropic hormone. Adrenocorticotropic hormone. When does it peak? At 4 a.m., 6 a.m., 8 a.m., 10 a.m. It peaks at 6 a.m. Peak ACTH secretion is seen at 6 a.m. Now, ACTH secretion is a pulsatile with circadian rhythm. It is pulsatile with circadian rhythm, peaking at 6 a.m. and reaching a nadir around midnight. Adrenocorticotropic hormone is secreted by anterior pituitary gland, and it plays a key role in regulating the cortisol levels from the adrenal cortex. The secretion of ACTH follows a diurnal or circadian rhythm with distinct peak and trough periods. ACTH secretion typically peaks in the early morning hours around 6 a.m. to 8 a.m. The peak coincides with highest level of cortisol, which is a part of body's natural circadian rhythm. So the correct option here is B. Peak ACTH secretion occurs at 6 a.m. Now let us move to the next one. Bardet-Biedl syndrome is characterized by. What is Bardet-Biedl syndrome? Anybody? Please type in the chat box. What is Bardet-Biedl syndrome? Bardet-Biedl syndrome. Anybody, please type in the chat box. Bardet-Biedl syndrome. It is a genetically heterogeneous disorder characterized by what is there in retinal dystrophy is there, obesity is there, polydactyly is there. Retinal dystrophy, obesity, polydactyly, renal anomalies, learning abnormalities, learning difficulties. Learning difficulty is seen. There is a mutation in multiple genes. So, from this discussion, we come to know that the genes commonly involved are BBS1 to BBS10 and others. BBS1, 2, 3, 4, 5, 6, 7, 8, 9, 10. BBS1 to BBS10. There is retinal dystrophy, rod cone dystrophy. Then polydactyly is there, obesity is there, renal abnormalities are there, learning disabilities are there, hypogonadism and genital anomalies are there. Other features are cardiovascular anomalies such as congenital heart defects, hearing loss, that is sensory neural hearing impairment may be there, Increased risk due to diabetes and metabolic syndrome. So diabetes mellitus can occur in these patients. It is autosomal recessive inheritance. Bardet-Biedl syndrome, autosomal recessive inheritance. The genes involved are BBS1 to BBS10. So the correct option here is D, all of the above: mental retardation, renal abnormalities, obesity. Which of the following gene is associated with Prader-Willi syndrome? Now, Prader-Willi syndrome, four options are there: GnRH1, PROK2, CH7, SNRPN. SNRPN. So, what do you think is the correct answer here? Prader-Willi syndrome, there is a deletion or disomy, uniparental disomy in chromosome 15. The gene involved in Prader-Willi syndrome is SNRPN. What is SNRPN? Small ribonucleoprotein polypeptide N. Small nuclear ribonucleoprotein polypeptide N. The position is 15q11.2. 15q11.2. Prader-Willi syndrome is a complex genetic disorder characterized by a variety of physical, behavioral, and cognitive abnormalities. It results from the loss of function of specific gene on chromosome 15, typically involving paternal deletion or maternal uniparental disomy on chromosome 15. The key features of Prader-Willi syndrome are hypotonia, hyperphagia and obesity, growth hormone deficiency, developmental delays, behavioral problems, psychiatric conditions, hypogonadism, distinct facial feature, narrow forehead, almond-shaped eyes, and a triangular mouth are characteristic of Prader-Willi syndrome. Sleep disturbances, sleep apnea, and other sleep-related issues. Chromosome 15 is involved. Paternal deletion or maternal uniparental disomy. Diagnosis is by genetic testing. Management is multidisciplinary approach: nutritional management, growth hormone therapy, behavior therapy, hormone replacement therapy, sleep apnea management. Now the correct answer here is SNRPN. Lymphocytic hypophysitis occurs mainly in A. Unmarried female, B. Postpartum female, C. Short-statured female, D. Infertile female. Let us look what is lymphocytic hypophysitis. It is usually occurs postpartum. So the correct option here is postpartum female. Gene associated with Unverrich-Lundborg disease is Unverrich-Lundborg disease is four options are given: A. CSTB, DEPDC5, EPM2A, LGI1. LGI1. Unverrich-Lundborg disease, also known as progressive myoclonus epilepsy type 1, EPM1, progressive myoclonic epilepsy type 1, is a genetic disorder characterized by myoclonus, that is involuntary jerks, and tonic-clonic seizures. Mutation are in the CSTB gene. Mutation are in the CSTB gene, that is cystatin B gene. This disorder is inherited in autosomal recessive manner. Both copies of gene in each cell have mutation. Unverrich-Lundborg disease, also known as progressive myoclonic epilepsy type 1, that is EPM1. It is a rare inherited neurodegenerative disorder characterized by myoclonus, that is involuntary muscle jerk, and epilepsy. It is a most common form of myoclonic epilepsy. The key features of this disease, Unverrich-Lundborg disease, is myoclonus, epileptic seizures, progressive nature. Other symptoms are ataxia, dysarthritis, cognitive disorder. CSTB gene is involved. Mutation in CSTB gene, also known as cystatin B. So the correct option here is A, cystatin B. Which of the following statement about Lennox-Gastaut syndrome is true? A. Multiple seizure type. B. EEG shows slow spike and wave discharge. C. Impaired cognitive function. D. All of the above. Now let us look at Lennox-Gastaut syndrome. Lennox-Gastaut syndrome. Lennox-Gastaut syndrome is a severe and rare form of childhood-onset epilepsy. It is characterized by multiple types of seizures, okay, cognitive impairment, distinctive electroencephalographic pattern. Lennox-Gastaut syndrome is considered most challenging epilepsy syndrome due to its refractive nature. So there are multiple seizure types, that is tonic seizure, atypical absence seizure, other type of seizures, cognitive and behavioral abnormality, intellectual disability, behavioral issues, EEG involvement, slow spike and wave pattern, paroxysmal fast activity. Onset typically begin between ages 3 and 5, but can start earlier or later. Many children with LGS have a history of previous infantile spasm or other early life features. So the correct option here is D, all of the above. Characteristic of Landau-Kleffner syndrome include characteristic of Landau-Kleffner syndrome. A. Auditory agnosia or word deafness. B. Normal hearing. C. Abnormal electrical activity. D. All of the above. Now, what is this Landau-Kleffner syndrome? What is this Landau-Kleffner syndrome? What happens in Landau-Kleffner syndrome? Can anybody type in the chat box, please? What happens in Landau-Kleffner syndrome? It is a childhood disorder. It is also called LKS. There is gradual or sudden loss of ability to understand and use spoken language. Sudden loss of ability to understand and use spoken language. That is auditory agnosia or word deafness. All children with Landau-Kleffner syndrome have abnormal EEG, and may have epileptic seizures. At night, hearing test shows normal hearing. Landau-Kleffner syndrome, also known as acquired epileptic aphasia, is a rare childhood neurologic disorder characterized by sudden or gradual development of aphasia, that is, loss of ability to understand or express speech, and an abnormal electroencephalogram. LKS primarily affects children between the age of 3 and 7 years. So the correct option here is D, all of the above. Gun barrel vision is best related to. Now gun barrel vision is best related to gun barrel vision. Gun barrel vision is due to A. Anton syndrome, B. Balint syndrome, C. Claude syndrome, D. Wallenberg syndrome. Let us look at each of the options carefully. Anton syndrome. What is Anton syndrome? What is Anton syndrome? Please, anybody type in the chat box. Anton syndrome, there is a loss of peripheral vision and central vision is spared. There is loss of peripheral vision and central vision is spared, resulting in gun barrel vision, Anton syndrome. Now, what is Claude syndrome? Claude syndrome is named after the neurologist Henry Claude. The syndrome results from midbrain damage leading to oculomotor nerve palsy, contralateral ataxia, and hemiparesis. Oculomotor nerve palsy, contralateral ataxia, and hemiparesis. It often arises from strokes or tumors affecting the cerebral peduncle impacting eye movement and motor control. Then balance syndrome. Balance syndrome is characterized by simultagnosia, optic ataxia, and oculomotor apraxia. Balance syndrome stems from parieto-occipital damage. It impairs visual processing, causing difficulty in perceiving multiple objects, coordinating movements, and controlling eye gaze. Then Anton syndrome involves cortical blindness with anosognosia, where patients deny their blindness despite clear evidence. It results from occipital lobe damage, often due to stroke or trauma, leading to confabulation and challenges in daily activities. So the correct option here is A. Anton syndrome. CADASIL is due to mutation of which gene? CADASIL is due to mutation of Notch3 gene. Pentobarb, refers to high-dose barbiturate for refractory elevated ICP. Polycystic lipomembranous osteodysplasia with sclerosing leukoencephalopathy. Polycystic lipomembranous osteodysplasia with sclerosing leukoencephalopathy (PLOSL) is also called as PLOSL is also called as PLOSL, also called as Nasu-Hakola disease, is autosomal recessive disease due to mutation in TYROBP and TREM2 that are expressed in microglia and osteoclast. These There occurs delayed differentiation of osteoclast and microgliosis, resulting in imbalance of bone remodeling capability, leading to bony cyst formation, inflammatory and immunological imbalance in brain, resulting in brain atrophy and dementia. It is called Nasu-Hakola disease. So the correct option here is Nasu-Hakola disease. Which of the following procedure is used for correction of TGA? All the three procedures: Mustard procedure, Semming procedure, and Rastelli procedure. So correct option here is D. Tarenfluorbil and simagastad are these are gamma secretase inhibitors. Tarenfluorbil and simagastad are gamma secretase inhibitors. Dementia pugilistica is related to recurrent head trauma in professional boxers. Familial Parkinson disease is associated with mutation in which of the following? D. Pink1, DJ1, and Parkin. Which of the following is about Kufor-Rakib syndrome is false? Now let us look at Kufor-Rakib syndrome. What it exactly? Kufor-Rakib syndrome, also called KRS, that is Park9, it is a rare autosomal recessive form of nigrostriatal pallidopyramidal neurodegeneration. Nigrostriatal pallidopyramidal neurodegeneration caused by ATP13A2 mutation is presenting as juvenile onset Parkinson's disease. Juvenile onset Parkinson's disease. Rapidly progressive symptom of Parkinson's: spasticity, supranuclear upper gauge paralysis, upgauge paralysis, facial fascial finger mini-myoclonus, visual hallucination, oculogyric spasm, usually noted between 12 and 16 years of age, leading to severe motor handicap. Kufor-Rakib syndrome is also known as Parkinson, is a rare genetic disorder characterized by early onset Parkinsonism with additional neurological feature. feature. So the correct option here is D, none of the above. The only oral agent that reduces dyskinesia while improving Parkinsonism feature is apantadine. Swollen axon of Purkinje cells are called as torpedoes. Which of the following is a gene for isolated dystonia? It is TORA1A, TAP1, ANO3, isolated dystonia. So this was all about Neet PG medicine. Prepare well, watch this video again and again. Please share this with your friends and close friends. It will help them a lot. It will also help you a lot. So please subscribe this channel. And if you want to join the 3-day masterclass, please click the link in the description box. You will reach a WhatsApp group. From there, I will tell the details of the 3-day free masterclass for Neet Pg. Wishing you all the best. Please subscribe and share this channel. Thanks a lot for patient. Wish you all the best.